Thank you for joining us today. Today, I'm proud to stand with Bermuda and our global partners as we celebrate the 23rd Annual Vaccination Week in the Americas and the 14th World Immunization Week. This year's call to action, Your Choice Makes a Difference, reminds us of all of us of the powerful role that each and every one of us play in safeguarding health and well-being through vaccination. Bermuda remains committed to immunizations as a foundation of public health. At the regional level, the Pan American Health Organization is championing Disease Elimination Initiative, which is a vision to reduce at least 30 communicable diseases and conditions by 2030, 11 of which are preventable with vaccines. And this bold gold standard underscores the goals of urgency and importance of our efforts, utilizing and uplifting us in a shared mission to protect lives. Here in Bermuda, our focus this year centers on three critical priorities. One, ensuring equitable access to vaccines throughout every stage of life. Every individual deserves the protection that vaccines provide from infancy through adulthood. Two, fostering trust in the safety and efficacy of vaccines. By providing accurate information and addressing misconceptions, we empower people to make informed decisions with confidence. And three, encouraging uptake of the HPV vaccine among adolescents, which is vital in preventing cervical cancer and other serious cancers, securing the health and future of our young people. As well, we are encouraging uptake of the MMR vaccine, which protects against measles, which is highly contagious and preventable. The measles vaccine is both safe and as well as life-saving, and we must all work together to ensure that the community is fully protected. To that end, the Department of Health will hold walk-in childhood vaccination catch-up clinics here at the Hamilton Health Clinic on April 29th and May 2nd. And I strongly encourage parents to attend these sessions if their child is not up to date with their vaccinations. Vaccination is more than a personal choice. It is a collective responsibility. It strengthens communities and it protects our future. This vaccination week, let us reaffirm our commitment to the message that your choice makes a difference. Together, let's build a healthier and brighter future for Bermuda. Thank you.
Good morning, everyone, and welcome to the opening of Vaccines Week in Bermuda. Thank you, Minister, for your kind words and opening words for Vaccines Week in Bermuda. Today, we celebrate alongside PAHO and World Health and 23 other countries in the Americas. Bermuda remains committed to promoting the importance of vaccination and highlighting its dedication to protecting the health and well-being of our community. As we celebrate Vaccines Week, I would like to take a moment to address recent cases of measles in Bermuda. Measles is a highly contagious and potentially serious disease that can be prevented with vaccination. It is essential that all individuals, especially those who are not up to date on their measles vaccination, get vaccinated as soon as possible to protect themselves and their loved ones, particularly our vulnerable populations and the young children. The measles vaccine is safe, effective, and has been extensively tested and proven to be a crucial tool in preventing the spread of measles. I urge all individuals who are not vaccinated against measles to take this opportunity to get vaccinated and protect themselves and their community. We are committed to ensuring that all individuals, regardless of age, socioeconomic status, or geological location, have access to recommended vaccinations. For example, we'll be hosting catch-up clinics from 4 to 6 p.m. on Tuesday, the 29th, and on Friday, 2nd of May at the Hamilton Health Center. We are working to build confidence in the safety and efficacy of all vaccines by providing accurate and reliable information and addressing concerns and misconceptions. Our main focus for this week is 1. Promoting equitable access to vaccines throughout the life course, building confidence in the safety and efficacy of all vaccines, promoting the HPV vaccine among adolescents, recognizing that it is a critical step in preventing cervical cancer and other related diseases. I urge all parents, caregivers, and healthcare providers to ensure that all children and adolescents are up to date on their recommended vaccinations, including the measles and HPV vaccines. I also encourage all individuals to take an active role in promoting vaccination and encouraging others to get vaccinated. Together, we can make a difference and protect the health and well-being of our community. Thank you. Good morning.
Question. With regards to the upcoming vaccination drive, will there be any costs associated with it for individuals that are seeking to get vaccinated or attend any of those clinics?
Sorry. So all vaccines for children are free of cost at the clinic. You're welcome.
And my second question, separate to the vaccinations but still in the framework of health, would someone be able to provide an update on the whooping cough cases that have been reported in Bermuda?
So, he's talking about the whooping cough case. So should I go ahead? So far we have had 2 positive cases of the whooping cough vaccine. What was the other? Okay.
Good morning, ladies. Sekou Hendrickson with the Royal Gazette. Kind of adding to the cases of whooping cough. Does this kind of highlight the need or the necessity to for people to get caught up on their vaccines? And are there any other, I guess, disease words that parents and adults should be aware of, particularly around the time spring comes along and our bodies change and our immune systems kind of take a hit, for lack of better words?
I can just say, generally the immunization program for children and adults have all of the required, the recommended vaccines, and we encourage everyone to adhere to that as far as possible according to schedule. And that includes the immunizations that start for children at 2 months of age, and that's a really important one. And they start on until adult as well. So one of the things you mentioned was seasonally. We've gone through the flu season. We thank everybody and those persons who participated having flu. So again, those that are seasonal, but the others are really year round, and they're important for us to try and be immunized in accordance with the schedule. And we have a child and an adult schedule. Thank you. Sorry.
I was just wondering, I know the child and adult schedules for vaccines, are those available for? Basically, how can people access those schedules in case they want to stay informed of what they should get and when?
So the Bermuda immunization have a schedule. Bermuda has an immunization schedule for all children from the baby. So we start at 2 months. So a baby will get a specific vaccines, which include the pertussis for the whooping cough. We have a combination vaccine for those kids. So if they get it every 2 months until they're 18 months old, they'll be protected. And they don't need a single vaccine as the adults would to get for the pertussis. So after you reach 15, at 15, the childhood vaccines schedule will stop. They get a Tdap at 15. After that, you gradually get into the adult section at 18. So at 18, or from 15, we get the Tdap, and that is the tetanus, diphtheria, and pertussis. But children get a combination that includes diphtheria and pertussis, and they get that right up to their 4 years. They have that vaccine.
Thank you.
You're welcome.
Thank you. Thank you, everyone. That concludes our press conference.